individuals that have intense and severe inflammatory conditions, or you recognize that there is dysregulation. And what I mean by that is blood sugar dysregulation that can be diagnosed through blood work. But you can predict that up to 7 years when insulin resistance starts. So that is sort of that first marker to then say, okay, we're going down a path. So let's pivot, let's shift.
Do you ever wonder which supplement you should be taking? Or if it is helping you in any way? Well, with my guest today, we are going to uncover best practices to help you get the most out of your daily nutraceuticals. Today's guest, I am joined by Dr. NavNirat Nibber. She is a graduate of the Canadian College of Naturopathic Medicine as a registered naturopathic doctor in Alberta. She is also a medical director for Advanced Orthomolecular Research, AOR. On an international stage, Dr. Nibber has published over 25 research publications. Welcome, Dr. NavNirat.
Thank you so much for having me.
Thank you for taking the time to join me today. I'm very excited about the topics we are going to be discussing. And I just wanted to touch on this for our listeners' sake who do not know what advanced molecular research, like orthomolecular supplementation, really means. Can you tell us a little bit more about orthomolecular?
Absolutely. Yes, it's certainly a mouthful and something that sounds like marbles in your mouth sometimes, orthomolecular. So our entire company, or the ethos of our formulation and design, is predicated on this concept of orthomolecular, which is a term that was coined by the late and great Dr. Linus Pauling, who did a lot of research into nutraceuticals. So that is finding bioactive components within nature, within foods, vitamins, minerals, that then have a defined and clear benefit to different aspects of our physiology and health. So at its core, orthomolecular research or supplementation specifically refers to ensuring that whatever ingredient you're taking, that the form that it's in, whether it's magnesium glycinate or citrate, or the combination that it's in, whether our B vitamins are combined with other B vitamins and what ratios those are in, are appropriate. So there's the right dose. Of course, that's going to make the biggest difference. The right form of a molecule and the right ingredient itself, and it's delivered in the right way. So whether it's a fat-soluble vitamin or a water-soluble vitamin, that changes how it gets delivered to the body. And so from a design perspective, when we're designing supplements, no one supplement will help everyone at the same time. So understanding physiology means that you understand these 4 components of design, those 4 R's, we say. And I think the most important R is the right individual. So when we're supplementing, everyone will have a different supplement regime. And I think that is the difference between an intentional and thoughtful supplementation plan and something where you're just sort of throwing all the supplements at the kitchen wall and seeing which ones stick.
But how, like, not everyone takes supplements. So who should take supplements, or even just in what you're just saying, like, how would I know, do I need a B vitamin? I mean, calcium, vitamin D, a lot of women are doing that, but how do you know which you should be taking?
Yes, and that is the most important thing is how do we know? And that is in taking in a combination of, I think, empowering ourselves for health, first of all. And that means taking into account subjective symptoms. So how am I experiencing my health? And also, how do I want to feel and behave in 5, 10 years? What are my health goals and the overarching
Right.
health? And
Right.
then also, what am I at risk for, whether it's based off of my family history or certain other lifestyle considerations? Am I vegan and vegetarian? What dietary choices am I making that can contribute to a future health outcome?
Yeah.
So
Yeah.
once you've established that subjective piece, it's really important to also combine that with objective measures. So that can be lab work, that can be imaging or
Mhm.
diagnostic help. And this is where it is helpful to have a healthcare practitioner guiding that. But once we've established certain objective measures, so for example, our vitamin D is being tested and it's coming in that low or even moderate to low.
Mhm. Mhm.
Ferritin is a good example for
Yeah.
iron supplementation. Then we can start to identify and pinpoint areas where we're either lacking or at risk of lacking. And then also conversely on the other side, it tells us about risk factors
Yes.
such as, cholesterol and our metabolic health, which then helps us again develop a very thoughtful and intentional supplement plan. So as you mentioned, not everyone takes or needs supplements. And I'm a big proponent of finding the right approach that works for you. So it's sometimes supplement is one tool in a larger tool bag, that will include diet and
Yeah.
activity.
Well, you know what's interesting right now? So I'm in Ontario and we're coming into, fall, the end of the summer, and I'm getting people coming in and they're sick.
Mhm.
And usually that's like mid-September once school's back and people are back at the office or, October. But now they're sick before the season's even started. So
Mhm.
what would you recommend for them? I mean, that's sort of a broad question,
Yeah.
but then also, how would we know if a supplement is working?
That's yeah, a large category, right?
Yeah, yeah,
So
sorry.
no, I
Yeah, yeah,
understand, and that
yeah.
is ultimately what people want, right? They want to take supplements or they want to do things that will help
Instant
with what they're
results.
currently facing.
Yeah,
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 yeah. And
yeah.
I do say with supplementation, with naturopathic medicine in general, it's I call it slow medicine. It's
Hmm.
about the long-term picture. So
Yes.
you're exactly right. We're seeing such a shift in seasonality. We used to have defined cold and flu seasons, and now it's sort of expanding and there's not clear times. And I think that's related to a number of factors. It can be related to stress in our lives. Globally, we see a lot more people experiencing and perceiving some of the uncertainty that exists, and that is translating to higher stress levels. And even if you're not immediately aware of that threat, there is still this low-lying chronic stress that exists. And how
Hmm.
that manifests in our physiology is people start to get some of that immune suppression when you have long-term stress. So that
Yeah.
can look like very frequent infections, can look like a lot of fatigue.
Yes.
So that stress component is certainly one we don't want to discount. The other aspect of this is exposure. So sometimes in the summer, we always used to think, oh, like it's when kids are in school, that's when we catch the bugs. But if you're going and traveling a lot or you're going out to different concerts and things, you're still getting that same exposure. It's still an opportunity there. So what we used to see is because in the summer you're getting really good vitamin D exposure, that people didn't maybe get as sick or notice that they got as sick. But what we're finding is absorption pathways or the ability to absorb and utilize that vitamin D, that can be impacted again by things like stress or previous infections, kidney function. So there's all these different aspects to it, which means that every approach we take has to be holistic. So if we're specifically talking about immune health, as we do approach, the fall season, really fortifying yourself with a lot of those basic components of the immune system, which is protein, making sure you're getting sufficient protein, making sure that you're engaging in healthy hygienic practices, again, the hand washing and things like that. But then do test and see what are your baseline levels. Fall is sort
Right.
of a nice time to get that reset and see if you need to test your ferritin, if you need to test your vitamin B12, because those can add sort of additional
Like
countdown.
cofactors,
Yeah, yeah,
cofactors,
yeah,
meaning they help other supplements or other nutrients absorb. And
that's exactly right.
when you're saying that too, and I always tell people like you're changing from summer to fall, your diet's going to change. And so take a moment, take a step back, try to take a step back, reset, and
Yes.
stop for a minute. Like don't run to all these activities if you can, and it's true, like the kids are going to get into their sporting events and, the cycle starts again, but take take a step back, and assess because yeah, you can't run on adrenaline and you burn out and then you get like perimenopausal into menopause and you have a horrible transition. But so in saying about cofactors, absorption and all of that, the other trend that I'm hearing is metabolic insufficiencies, metabolic syndrome. And so really it's people are inflamed. And how do we bring that inflammation down? Um, and from me, like people come in and so midlife women and they say, I can't lose weight. I have no energy. I have brain fog, my cholesterol and non-alcoholic fatty liver is the other one I'm getting. And I said, well, and it's hard in a stand-up retail setting, but to get all the factors in. But to me, I feel the bottom line is that metabolic insufficiencies and inflammation.
Yeah, you're right. Inflammation underpins so much of how disease progresses.
Hmm.
So it sometimes it's meant to be responsive. It's meant to be able to go up in inflammation is supposed to address an acute threat, right?
Right.
But the coming down is really important. And we see that with stress as well, right? Like it's good to have a strong, robust stress response. It's
Hmm.
just about making sure that it can then come back down. So what you said about, that reset in when you're transitioning to a new season works
Hmm.
for seasonality and immune support. It works for the menopausal hormonal changes, right? Everything is about resetting and getting back to homeostasis. And metabolic syndromes, when we break it down to its simplest components, metabolism is about utilizing and directing our energy sources, right? And then producing more energy.
How would you
So,
do that though, Dr. Neverett? How would
yeah,
you refocus that?
yeah, refocusing. So sometimes that requires a drastic shift, and that is in those individuals that have pretty intense and severe inflammatory conditions, or you recognize that there is dysregulation. And what I mean by that is blood sugar dysregulation that can be diagnosed through blood work. But you can you can predict that up to 7 years when insulin resistance starts. So that is sort of that first marker to then say, okay, we're going down a path. So let's pivot, let's shift. And what that will look like is a pretty holistic lifestyle shift or refocusing. So there's individuals who they have genetic propensities or they have a certain set of standards that means that they're on that path already. And it's not to say that they can't get off. It just means it's the level of intensity of pushing that gauge back. So specifically with insulin resistance, I find you can look at symptomatic pictures. So that can be things like more skin tags, very, very low energy during the day or post meal because there isn't a proper blood sugar or sorry, insulin response, and that can then eventually translate to a blood sugar response. It can also be some of that darkening around the folds of the neck armpits, under the breasts, that darkening of skin can be an indicator for some of that insulin resistance. So these are all things where, again, you would observe and check in with yourself and then do a workup with a healthcare practitioner. Once you get insights that maybe you do have insulin resistance, what you need to do is shift. Basically, you're retraining so that the cells become very sensitive. You're resensitizing, and that requires sort of the same training as timing meals, timing activity after meals. So going on a long walk or doing even 10, I think they said a few squats right after you eat a meal, doing some resisted exercise and really focusing, especially for perimenopausal, menopausal women, exercising and doing weightlifting is one of the easiest ways to affect multiple different systems. It affects your bone density, it affects your metabolic health, and it's affecting your cardiovascular health. Sort of the skeletal system entirely is, it never hurts to lift heavy things.
Yeah. Well, I just heard research that came out of New Zealand in regards to dementia and
Mm.
women with stronger legs, like thighs, are less prone to having dementia. I don't know if you've
Right.
seen that, but
Yeah.
so yeah, when you're saying squats, do your squats after dinner, you know?
Yeah.
Yeah,
Yeah.
yeah, I've
Even
not
while
heard
you're just
that.
washing up and putting things
Yeah,
away, just
yeah, yeah,
squatting.
yeah,
Yeah.
yeah,
Yeah. We've
yeah.
become, I think, in society, again, with jobs, so much of our life is digitized, computerized. So we are
Sure.
static. We're
Yes.
not moving as much.
Yeah. Yeah.
So again, any excuse to be mobile, it should be taken as an opportunity, right? Like we
Yeah.
don't even need
Yeah.
to track it, just, whether it's stairs or elevator. And these are the simple things, right? We don't need to
Hmm.
complicate it as much.
That's right. Yeah. And I'm all about practical lifestyle changes because if it's not practical, you won't do it. If it gets too
Exactly.
complicated, so everyone can walk after dinner. And again, I'm in Ontario, it's going to get cold. That'll be a challenge.
Hmm.
But if you have no energy, so should you, like, especially like you said, you eat, your insulin drops, your blood sugar drops, and oh, I don't feel like going for a walk. I'm exhausted now. You worked all
Yeah.
day. And yeah, so how do you shift that to, yeah, like iron, maybe
Yeah.
vitamin C? Yeah.
Yeah, this is that is always the challenge. It's like it becomes the chicken and the egg scenario.
Yes.
I'm too tired to work out, but I can't feel
Yeah.
better unless I
Yeah.
work out. So again, I think the starting with those small, manageable, but consistent changes.
Yes. Yeah.
And oftentimes there can be one or two vitamin and mineral insufficiencies that maybe
Right.
are they're not the whole picture. They're not the reason that you feel terrible, but certainly they're the biggest obstacle to that hindrance
Mhm.
to even getting a routine. So I always say, do test iron. We often think that as we're approaching menopause, that iron doesn't need to be tested.
I was gonna say that. Yeah. They think they don't need
Yeah, I
iron
think.
anymore. Yeah. And they feel
Hmm.
better when they start. And B12. Yeah.
Yes,
Yeah.
B12
Yeah.
very much so. And B12, there's quite a fast, while iron takes, 3 to 4 months to really build up those reserves
Yeah.
and stores and for that to be reflected in ferritin, with B12, it's a faster uptake, so it can
Mm.
support energy that way. The other thing is magnesium,
Mm.
and magnesium, depending on the salt form, so with all
Right.
minerals, depending on what it's bound to, it can help
Mm.
direct to whatever tissue it needs to go to. But
Yeah.
magnesium, I think, is it's a lot more prominent to have insufficient levels. And unfortunately, we don't have a great blood test to assess what the magnesium levels are in our
Okay.
tissues. But that
Okay.
can be a nice, simple, generalized mineral just to get
Yeah.
you
Yeah.
to feel well enough to maybe start implementing better sleep hygiene habits or better morning routines.
Okay, so speaking of iron, so I get, and I'm trying to look up the proper terminology. that women are coming in asking for iron ferrous or iron,
Yeah, so
sorry,
ferrous iron. So there's
or
different forms of iron.
yeah,
There's
but
because
it's
iron,
300 milligrams. So when they see what I have is like 10 to,
yeah.
20, and they're like, well, that's my doctor said I need 300 milligrams.
Yeah, yeah.
So can you speak to that?
Of course. Yeah. So salt forms of any of these minerals is going to be, like we said, it'll help direct, it'll help change absorption patterns. And if we look at a ferric pyrophosphate versus ferrous salt form, what these denote is the form that it's in, and some offer a little bit more stability in the capsules. Okay, so that's one aspect. And then some offer better absorbability and comfort when you're actually taking them. So taking these very, very high doses is appropriate when you're at an insufficient level. However, it often comes with those associated side effects of gastrointestinal discomfort or constipation when we're using, so we have a ferrous sulfate and ferric pyrophosphates forms. We've also looked at iron bisglycinate. Some of these options, again, based off of the RDA for iron, it's 30 milligrams per day. Yeah. It's been a minute since I looked at RDAs. So there's a few factors to consider is if you're doing alternate day dosing, so taking it every second day, then taking a very, very high dose at once is reasonable. But our bodies do release something called hepcidin in response to iron overload, right? Because too much iron in a system usually indicates some sort of infection. That's like from an evolutionary perspective, we develop these mechanisms to stop ourselves from getting too much iron. So when it releases that hepcidin, it takes about 24 hours for that to reset. So you'll always reach sort of a threshold amount, and that's dictated by your body's needs, where you will stop absorption. And so I think it's important when you are taking it to make note of the form. And again, like I said, there's lots of different options and offer different benefits and support, but make a note of what form you're taking and then decide if you're going to do daily dosing or alternate day dosing. So every second day. And then being mindful of iron does compete with absorption for many other minerals, but if you are taking it with food or I mean with you want to take it away from calcium containing supplements. I know zinc and iron is something people are talking about a lot, how they compete for
Okay.
absorption. That I would say is yes, there's a competitive inhibition there, but it is minor compared to like a
So
calcium is.
zinc and iron do not take at the same time?
Well, again,
Yeah.
they are in a lot of multivitamins
Yeah.
together,
Yeah.
and I think that's just a function of a multivitamin. Its role and purpose is to give you
Okay.
everything at once, and then your
Okay.
body
Yeah.
absorbs as
Yeah.
needed. Whereas if you're taking just a specific iron supplement,
Yeah.
yeah, consider taking that with just a B12 and a vitamin C,
Yeah.
as that will
Yeah.
give you the best
Yeah.
absorption.
Well, I think with a multi, it's a little bit of everything and sometimes
Yes,
a lot of nothing. Sorry.
can
Yeah.
be. Yeah,
Yeah.
yeah,
Yeah. Because you'll still need maybe extra B12 or calcium or vitamin
yeah,
C or D or something else. So, yeah. Yeah.
yeah.
This was a lot of stuff to cover. And just like in a nutshell, I think really to summarize it, and feel free to correct me, but it's just assess yourself. Like people go online and they'll talk to Dr. Google or Mr. AI.
Mhm,
And, there's things now where like we get people coming to the store and they'll ask Chat GPT if they should take a certain supplement based on
mhm.
what medication and all of this. And that's well and good, but you got to also listen to your body too.
Yes.
So, yeah, just take a step back and assess, and if you're taking iron, is it helping you energy, even clarity,
Hmm.
and my thing is you wake up in the morning and you have energy,
Hmm.
right? So, yeah, so assess.
Yeah, I appreciate you contextualizing that with AI because the reality is that this is part of the diagnostic process for many people now. And it is those recommendations are being made, similar to how we used to get Google ads or our algorithms would feed us certain things. It is basing its recommendations off of existing data. That means also marketing data and things like that. So checking the sources on those recommendations is also very important and framing the questions that you're asking is really important. So ensuring instead of making it generalized, what magnesium should I take? Because I feel bad, specify again those same health goals. So it can be really helpful as a tool for that assessment, but be sure that you take that moment first to understand what your own health goals and concerns are, and then you can ask it the right prompts. Then your prompts suddenly make sense. Then the next step would be once you've identified it, then if you take the same orthomolecular concept, find out what is the right form for me based off of those goals, what is the right dose for me based off of not just health goals, but also current levels. And what I mean by that is there's a maintenance level and there's a therapeutic level. So when we're talking about the iron salts, at the very, very high doses, 175, 300 milligrams, that is for a therapeutic window. That's for a period of time. Once you have reached and attained levels, same with vitamin D, you can dose high. And then once you reach that, there becomes either a maintenance dose or you take a supplement holiday. You take a brief pause. So again, all of it becomes orthomolecular because you are the right person. Now find out all of those other rights
Yes. Yeah. Yeah. You're the
that
host.
exactly. Yeah.
Yeah. Yeah. Sounds good. Sounds good. So thank you for your time. And people just, assess yourself and know which vitamin or supplement, nutrient you need to get you through this fall with energy, no brain fog,
Yep.
and yeah, and not being sick.
Yes. Wake up feeling good and then
Yeah.
staying good.
Yeah.
Yep.
Yeah. Thank you, Dr. NavNirat. This was beautiful. Thank you so much. I love your explanations. I could talk about this all day.
Thank you so much, Vicky,
Uh,
and a pleasure to chat with you about this.
all right. Thank you. I am so appreciative of the research work that Dr. NavNirat is doing to advance orthomolecular understanding and health. That was started by Louis Pauling way back in the late 60s. There is always room for fine tuning our health, and just like we mentioned in the episode, to take a step back, assess what are your health goals? Where do you see yourself in 6 months, 1 year, or even 5 years? What do you want accomplished in your health? Listen to your body, it is giving you data. When I started these podcasts, I wanted to put some clarity into your wellness journey to make practical and obtainable tips and ideas to live your best and healthy life. Want to stay in touch? You will find all of Dr. NavNirat's information in the show notes below. As well, you can find all my details in the show note. If you are enjoying these videos and the information, feel free to share it with a friend. Give me a like, a subscribe, leave a comment. I look at all the comments. Every time you interact with this channel, you are helping it to grow, and it is greatly appreciated.